Okay, class, this is your first chapter of pathology. We're going to be covering just the basics, the basic knowledge and terminology used. So here's your outline. We're going to discuss disease. Within the disease, we're going to talk about inflammation, edema, ischemia and infarct, hemorrhage, alterations of cell growth, neoplasia. We're also going to talk about hereditary diseases, disorders of immunity, infectious disease, exposure, and acquired immunodeficiency syndrome, so AIDS. So your objectives, you're going to want to make sure that you can cover these, and your key terms. Here are all your key terms. Very important that you know what these are, or at least have an idea what they are. So when we're defining disease, it is the pattern of the body's response to some form of injury that causes a deviation from the variations of normal conditions. So there's a lot of different things that can cause the body to respond to an injury. So we have obviously hereditary, so your genes, trauma, infectious organisms, vascular process, and metabolic processes that can cause disease. So the signs, these are measurable or objective manifestations. So if we talk about they have fever, they have red and swelling of the tissues, that's what we're talking about with signs. Symptoms are feelings that the patient describes, so they're subjective. So when you write down patient states, feels nauseous, if you don't see them throwing up, then that is a symptom, not a sign. If they're throwing up, that would be a sign. So asymptomatic, so without any kind of manifestations. So it's completely asymptomatic, nothing that you can see. The diagnosis is the identification of a disease process. The etiology is the study of the cause of the disease process. Idiopathic is the underlying cause is unknown. We have the prognosis, which is really what the patient outcome can be. Syndrome is a linked combination of signs and symptoms. So if you combine the two, we've got a syndrome. Radiogenic is the disease caused by a physician or a treatment. And what that could be is like you're doing a lung biopsy, and during the lung biopsy you get a pneumothorax. So that would be how that would be classified. Nosocomial infections, so within the facility, within the hospital or acute care facilities where they contracted the infection, and community acquired infections. So that's when they get it out in the public. So inflammation is defined as the initial response of body's tissue to local injury. So there are 5 clinical signs. There's redness, heat, swelling, pain, and loss of function. So redness, rubor, heat, calor, swelling, tumor, and pain, dolor. Events that affect inflammatory response. So alterations in blood flow and vascular permeability. So yes, you're going to have increased blood flow to the area. So you have migration of circulating white cells to the tissues or to the injured site. You have some phagocytosis with enzymatic digestion of dead cells and tissue elements. And then you have the repair happening. So repair of the injury by regeneration of normal cells. All right, so some of the terms here. Inflammation, initial response of the tissue to local injury. Permeable membrane allows fluid and cells to pass from one another for a tissue or a location. So granulation tissue is fibrous, scar replaces destroyed tissue. So that's our scar tissue. And phagogenic bacteria, so that is the thick yellow fluid we call pus, so it's full dead white cells. And abscess is localized, usually encapsulated. Encapsulated means enclosed collection of fluid. And bacteremia is potential involvement of other organs and tissues of the body by organisms invading the blood cells. So edema is the accumulation of abnormal amounts of fluid in the extracellular tissue spaces or body cavities. So here's edema of the ankles, and you see this a lot with people that have heart failure. So edema is the accumulation of abnormal amounts of fluids in the intracellular tissue spaces or body cavities. Sarca is generalized edema occurs with pronounced swelling of subcutaneous tissues throughout the body. And there's elephantitis, which is localized lymphatic obstruction resulting in localized edema. So when we talk about ischemia, there's a difference between ischemia and infarct. So ischemia refers to the interference of blood supply to an organ or part of the organ. It deprives the cells and tissues of oxygen and nutrients. Now, it's a reduction in flow. It's not a complete cutoff. So ischemia means there's a reduction. So there's an interference with the supply of the nutrients to that body part where it's not able to function properly. It will lead to infarct if it's not resolved. So may be caused by a narrowing of an artery, such as atherosclerosis. There's thrombotic occlusion and embolic occlusion. So when we talk about a pulmonary embolism, it's a blood clot that usually travels from the lower extremities. It comes up, and you can see here we've got what looks like a vessel, but that's a blood clot that was in the vessel that's come up the pulmonary trunks, and now it's in the left pulmonary artery. And you can see a piece right here. We have filling, these are called filling defects. You can see all the filling defects here. The right side looks almost completely occluded, whereas the left side has some ischemic to it. So there is some contrast and blood flow getting through, where the right side there is some also. So this is an ischemic process here. If it was completely cut off, it would be an infarct. So an infarct is a localized area of ischemic necrosis with a tissue or organ. So you can see here in the brain we have wiped out. So here is your right middle cerebral, and we don't have a left. So we've wiped out the left blood flow to the brain, which is not good. So this is an infarct. There is no blood coming through. So the brain tissue is going to die. So hemorrhage is the rupture of a blood vessel that allows blood to escape externally or internally within the surrounding tissues or cavities. So it's bleeding into the tissues, resulting in a hematoma. So a hemorrhage goes to a hematoma. As you can see here, this is a slice of the brain. You can see a huge hematoma within the brain. So ischemia, interference of blood supply to an organ, deprives the cells and tissues of oxygen and nutrients, where infarct is localized area of ischemic necrosis produced by occlusion of either arterial supply or venous drainage, and hemorrhage implies a rupture of a blood vessel, and hematoma is accumulation of blood trapped within the body tissues. Alterations of cell growth refers to the changes in the number and the size of the cells, their differentiation, and their arrangement. May develop in response to a physiologic stimuli. So numerous terms are associated with alterations in cell growths. Neoplasia is the Latin word for new growth. It is defined as an abnormal proliferation of cells that are no longer controlled by the factors that govern the growth of normal cells. So it's an abnormal growth. It may be benign or malignant. So when we talk about malignant, we're talking about cancer. When we look at the alterations of cell growth here, just a summary, we have atrophy, which is reduction in the size or the number of cells in an organ or tissue with a corresponding decrease of function. Where hypertrophy is increase in the size of the cells of a tissue or organ in response to the demand for increased function. Where hyperplasia is an increase in the number of cells in a tissue or organ, and dysplasia is loss of uniformity of individual cells in their architectural orientation. Neoplasia is ungoverned abnormal proliferation of cells. Oncology is the study of neoplasms or tumors, and benign is a growth which closely resembles its cell of origin in structure and function. So it's just growing, like a part of the kidney would be growing more than the other side. Malignant is neoplastic growth that invades and destroys adjacent structures. Metastasize is a malignant neoplasm that travels to different sites. And a carcinoma is a malignant neoplasm of epithelial cell origin. And anaplastic is undifferentiated cell growth without form. And a sarcoma is highly malignant tumor originating from connective tissue. Lymphatic spread is a major route for cancer to spread. And hematogenous spread is malignant tumors that have invaded the circulatory system and travel as like little neoplastic emboli. So grading, when we're talking about cancer, is assessment of aggressiveness or degree of malignancy. So we have grading and staging. So staging is the extensiveness of the tumor at the primary site and the presence or absence of metastasis to lymph nodes and distant organs. So epidemiology is a study of determinants of disease events in their given population. Oh, epidemiology, sorry. And morbidity is the rate that an illness or abnormality occurs, and mortality reflects the number of deaths by a disease in a population. So hereditary disease results from abnormality within the DNA. They pass from one generation to the next through genetic information contained in the nucleus of each cell. So the hereditary process, so genetic information contained in the nucleus of each cell, passes to the next generation. The autosomes, there's 44 chromosomes other than the X and the Y, and the dominant genes always produce an effect where the recessive genes manifest themselves when a person is homozygous for that trait. So mutations, alterations in the DNA structures that may become permanent hereditary changes. So disorders of the immunity, there are three types of immune reactions. There's anaphylactic, which is hypotension and vascular collapse. You can get highs, there can be bronchial spasms or laryngeal edema. It's anaphylactic shock is not good. So cytotoxic reaction is a reaction that leads to cell destruction or lysis or phagocytosis. There's also a delayed where the first exposure is not usually bad. However, the next exposure to antibodies attack the antigen more aggressively, where the reaction is a lot worse. So I have that with iodine and latex. So each time I'm exposed to those things, my reactions get stronger and stronger. So antigen, what is it? It's a foreign substance that invokes an immune response, antibody. Immunoglobulin response to the antigen makes everything harmless. So the immune, it protects against the antigen, antibodies binding with antigens to make harmless, and you have active immunity forming antibodies to counteract an antigen by way of vaccine. And a vaccine is contact with dead or deactivated microorganisms to form antibodies. Toxoid is treated toxins with an antigen powder to produce immunity by creating antibodies. So anaphylactic reaction is hypersensitivity reaction resulting in histamine release. So then we go into our standard precautions where protection utilized when deriving healthcare services for any persons. You should use it always. And then your PPE, are your gowns, gloves, masks, shoe covers, eye protection. So we use that to prevent transmission of infectious agents. And transmission-based precautions, so it's additional protective equipment to prevent the spread of highly infectious pathogens through contact, droplet, or airborne transmission. So we are at risk as healthcare providers, so we should always follow the CDC's precautions and use appropriate protective personal equipment and utilize transmission-based precautions. So acquired immunodeficiency syndrome, so AIDS is caused by human immunodeficiency virus, HIV. High-risk population is young heterosexual males and IV drug users. I don't know about this, seems kind of out of date, but okay, might still stand true. Those affected are at greatest risk for opportunist infections. There's pneumonia is a really big one. It also goes into Kaposi sarcoma, which is a lung cancer that is deadly. And also AIDS can move up into the brain where we get these white lesions, ring enhancement lesions here within the brain. Very sad. So it's a metastatic spread there. All right, so that's all. Good luck.